from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about clinical research and what patient participants need to know. Our guest today is Dr. Kirk Volker, the Medical Director of Clinical Research here at Sarasota Memorial. Dr. Volker, thank you so much for joining us today.
My pleasure to be here.
Why is clinical research so important? I know that's a broad question, but why is it so important?
Well, clinical research is basically just asking questions and trying to find validated answers in order to improve, the way that we approach things from a healthcare system. If you think about it, back in the days of leeches, basically the whole bloodletting with leeches was based on somebody's opinion, and they were a high-ranking official's opinion. And everybody said, well, if they say it's true, it must be true. And so that sort of anecdotal evidence still persists today in our medical system. What we do with clinical research is that we try to ask these questions and prove whether or not they're correct. And that is the whole purpose, whether we're looking at developing a new drug, new device, looking at population studies.
Are there different types of research that patients may be able to participate in?
Yeah, the term research is so broad. Everything from these huge population studies that you never know you're participating in to something as intimate as your own personal DNA. And so here at Sarasota Memorial, what we look at are mostly drug and device studies.
Why would a patient choose to participate in clinical research?
Well, first of all, you can have access to cutting-edge therapies, whether they be drugs or devices, that may not come to fruition for another 5 or 10 years. And a lot of people don't have that time for some of these drugs and devices. The other thing is that with clinical research, you get more exposure to the medical field. You get more people checking in on you. And then there's altruistic, reasons that you are helping advance medical science. And, in a lot of people, it really makes them feel good to be able to participate and say, yeah, I meant something.
So for someone who might be listening or watching this and saying, I do want to participate, I want to talk a little bit about the process of actually getting involved. So first, how would a patient know about research trials available nationwide or at their local hospital, like if they live in our community and come to Sarasota Memorial?
Yeah, and that's a huge question, but it boils down to basically if you go on the internet to clinicaltrials.gov, all the major trials are put there all over the United States. And so if you're looking for something, whether it's rare or common, you can put in the search term and find out whether or not it's offered in this area. Now for SMH in particular, you can go to our website, smh.com, click on the research tab, and then there's another button that goes to current trials offered. But actually, it's probably easier to go to clinicaltrials.gov.
And if they see a clinical research trial that might be related to a diagnosis they've recently received or they've lived with for a long time and they're looking for that cutting edge treatment, how can a patient actually find out if they're eligible for one of those trials?
These trials are so complex and what we call inclusion-exclusion criteria are so complex. The best way, contact the clinical trial. They usually have a number, somebody who is willing to talk to you and spend time talking about you and your particular, process, and they are the best people to screen you.
Are there pretrial tests that people might have to participate in beyond just that phone call?
Yeah. So there are pretrial tests for patients that might have a certain disease. Let's say I'm looking at an emphysema patient and my trial says you must have 30% of your lung destroyed. Well, a lot of emphysema patients already have lung function tests that show whether or not their lungs are destroyed. But if you don't have that, well, then your doctor's going to have to do that test before you can be referred to the trial. But once you're referred to the trial and part of the trial, all the additional tests should be paid for by the trial.
Typically, do patients have to be referred to a trial by their primary care
No.
or?
No, they can just, as easy as going on clinicaltrials.gov, finding out the contact person and giving them a call.
What should a patient ask before they participate? Because sometimes things might sound great, but they need to know a lot of information. This is in relation to their health.
Yeah, and so there are different aspects of trials. There are, like for drug trials, we have phase 1 trials, which are sort of like, this is the first time it's being used in a human. We've got phase 2 where it's been used in humans, but not a lot of humans. And then phase 3, which is the trial that we use it in a lot of humans. So you're going to want to know is, one, what's in it for me? Okay, how is this going to benefit me? And how is this better than standard of care? Number 2 is, what are the risks? What are the other benefits? What information do you have from other people who have had this procedure done? And sometimes it's, only a handful of people. Sometimes it's several hundred people. But you're going to want to know that. Is there any cost to me? In general, here at the hospital, there should not be a cost for clinical research trials, other than what insurance normally pays or a procedure. If I'm going to go get a hernia done and I'm looking at it, a doctor who has got a trial saying I can do it better with my left hand than my right hand, yeah, that's going to cost you the same hernia repair. Okay, but it should not be. There are some community-based research centers that patients have to pay to get in. Always be skeptical of that, and always talk to your doctor. Or other healthcare professional to say, what do you think about this?
Do patients have particular rights when it comes to clinical research as a participant?
Oh, absolutely. And the biggest right and the biggest thing to think about is you have the right to say no at any time. And if things are not the way you like it, if things are, you don't think that for whatever reason that the trial is not good for you, once you sign on the informed consent, you can say no. But the informed consent process, that brings me to that, is this process where the researcher should sit down with you and go over this long document of all the possible things that could go wrong. Why are we doing this? And help you really understand that trial. We have a institutional review board whose job it is to oversee all the clinical trials and protect patients' rights. And then once the trial is going, we often have something called a data safety and monitoring board, which is at the sponsor's end. They look at all the results from all the centers and try to make sure that there are no adverse events happening, out of proportion. So all those things are there to protect you as a participant.
If you're a participant in a trial, for the patient's knowledge, how in depth are you expected to report any health event that occurs during that time in the trial? How involved can these really be?
Yeah, they vary, and again, it can be anything from that you're part of this population study where you basically enroll and say it's okay to use my information, and I never have to report to them again, to something like if we're looking at a drug and pharmacodynamics in the drug, and you have to go in several times for blood draws, so that should be part of what you're asking too, is how is this clinical trial going to affect my lifestyle?
Absolutely. Let's talk about clinical research here at Sarasota Memorial in particular. Why do you think it's so important that a community hospital invest in clinical research? Because it's not necessarily common that every community hospital or healthcare system has such a robust clinical research.
That's a really great question, because community hospitals usually do not have research. Research takes a lot of resources, a lot of time and energy. A lot of community physicians are so busy in their day-to-day that they don't have a lot of bandwidth to do research. Fortunately, here at Sarasota, we have a lot of physicians who are interested in the research aspect of things and the more academic things, and they actually may have come from academic centers. And part of the allure of Sarasota Memorial is that they get to do research here as well as their clinical practice.
And how important is it to have access to some of those cutting edge medicines and procedures and things like you were talking about at a community hospital setting where that's typically not the case.
That's right. That's hugely important. So not only does the research attract doctors to the area, top-notch doctors, it makes these drugs and devices available maybe 5 years, 10 years before they're available to the community. We were doing the aortic valve, transcatheter aortic valve replacements, the TAVRs, here, 5 years before it was FDA approved. And so patients did not have to have a full sternotomy, cut their chest open to replace their aortic valve. And some of them were too frail to undergo that surgery. And before we were able to do that TAVR valve, we would say, yeah, good luck. We don't have anything to offer you. But now we have something to offer them. And that's true for our research in cancer. You get, access to cancer drugs that are just research-oriented, procedures, devices, and other drugs.
Right now, as we speak, the new Kolchowski Research and Education Institute is being built on the SMH Sarasota campus, close to where we're sitting,
Yes.
actually. What is the investment going to do for clinical research in this community?
Yeah, that's going to be a gorgeous center. And right now, for Sarasota Memorial, the research centers are scattered. And around the campus, wherever they can sort of push us. And I've been the medical director for, 12 to 15 years and been in 3 or 4 different places, okay? As the hospital needs grow, we get shoved around. So this is actually going to be some place where we can all coalesce into one building with education also. And sort of like the water cooler, right? Some great ideas come at the water cooler at office while people are just standing around. You get to interact with other researchers, and that is a big improvement on the environment. And so I think that community, creating that research-oriented community, is what's going to happen at the Kolchowski Center.
And what impact is that going to have on the local patient? Because local patients hear about all the growth at Sarasota Memorial, and there is a lot of it, and they think, well, how does that impact me? Yeah. How is this going to impact day to day?
So what it's going to do is improve processes, improve access to care, to new medications. And so you may not see it directly, but it underneath the surface of everything, it is rising the tide.
And like you mentioned before, just the recruitment of medical providers amidst a national shortage of providers is huge.
Yeah, SMH is such a wonderful place to work. I mean, first of all, Sarasota, how can you get much better than that, right? And then you've got this wonderful academic institute here, that provides, research if you want to do that, just has all these things that are so attractive to top-notch physicians.
Now we think about how this impacts, or we discussed how this impacts patients now, if they're participating in clinical research, or they might see some of these new advancements then be FDA approved. But long term, even though for those patients not participating in clinical research, how does this impact them?
Well, I mean, long term, it raises the tide that lifts all boats. I guess that's the best way to say it. And even if you're not participating in it, the doctor that's working with you may have learned something from the research trial that they did that they can apply to this, or that you may not need it now, but they've got it in the back. It increases their toolbox of tools, right? So you may not need it right now, but they've got it in the back of their mind that, okay, if this doesn't work, plan C is to try this research trial.
Well, and TAVR is a perfect example. Yeah. Now it's widely available nationwide, but it was here in Sarasota for so long.
Exactly, yes.
Dr. Volker, is there anything else you want to add? I know you as you mentioned, you've been medical director for well over a decade. So clinical research certainly excites you. You've been involved in a long time.
No, I think the only thing I want to add is my gratitude to the hundreds of people who have participated in the clinical research, because they are helping change the whole culture of medicine, and helping us, develop new and more exciting processes, drugs, devices, et cetera.
Absolutely. Dr. Volker, thank you so much for joining us today.
My pleasure.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.